Hi everyone, my name is Priya Patel. I'm the physician assistant here at Tussin Longevity Center, and I'd like to welcome you guys all tonight to our monthly seminar. We've been doing these seminars for about over a year and a half now, or about a little over a year, and this is our 5th live streamed seminar. So I'd like to welcome everyone joining us from home as well. And so tonight we are going to be discussing the importance of gut health. And I chose this topic because it personally relates to me. When I first started shadowing here at Tussin Longevity Center about a year and a half ago, I started off by shadowing the doctors, and I was starting to learn a lot about my own health, and I was kind of going through my own personal health journey, and I was experiencing a lot of symptoms that I didn't realize were stemming from the gut. So things like anxiety and some skin conditions, and I never had any GI, gastrointestinal related symptoms, so I never thought that it could be stemming from there. But as I learned from the doctors, I shadowed and I did a lot of research, I did a lot of reading, and now I'm practicing, so I get to really help my patients in the same way that I got to help myself. So I wanted to share that with you guys tonight and basically, allow you guys to be able to change your dietary habits or make different changes that can help your health. So I just hope everyone can learn something new tonight, and that would make me happy. So I've come up with a series of questions, and we'll go through these questions. And if there's any questions from yourself, if you have any questions, just feel free to ask those questions. And along with the live stream, if there's any questions from there, we'll be taking those. I'll do my best to answer the questions. And also, as a disclaimer, this is by no means a way of diagnosing or treating anyone that's listening. So it's just a way to share knowledge and allow you guys to learn some more information. But if there is something that's bothering you or you'd like to be evaluated further, definitely come to see us. There's 5 of us here at TLC, and we'll be able to come up with an individualized treatment plan for you. Okay, so let's get started with the questions. Number 1, quote, "All disease begins in the gut," was stated by blank, the father of modern medicine, over 2,000 years ago. Does anyone know the answer? No. Okay, so the answer to that is Hippocrates. He was a Greek physician, and he made this statement over 2,000 years ago. So I wanted to start with this statement because it really speaks to how important the gut health is. And our body sees the world through our digestive tract. So the food we eat is really important, and so that's what we're going to discuss tonight. It's the nutrition we get from our food is going to impact our gut lining. It's going to impact everything. It provides us with nutrition to help us grow when we're children. It helps us heal through adulthood, and it also helps prevent aging as we get older. So I thought it was just incredible that the father of modern medicine, Hippocrates, made this statement 2,000 years ago, and he didn't have the technology, microscopes or the research to tell him this. And so he probably just used common sense, and he had an intuition, maybe a gut feeling that, things are really stemming from the gut. So nowadays we have all that technology, we have the research, and it's really proving to be true. So especially in regards to chronic illness. So things like diabetes, heart disease, neurodegenerative diseases like dementia and autoimmune conditions, the statement is really holding true. Okay, so number 2, true or false? Whatever is inside of your intestinal tract is not truly inside of your body.
False.
False. The answer is true, actually. So we have to think of our gut line, our digestive tract as a pipeline, a tube that goes from one end to the next. And so if you look at the picture I provided for you guys on the next page, you'll see basically a picture of the anatomy of the gut tract and of the digestive tract. And so it's a connected open tube from one end to the other. So it goes from our mouth down to our anus, and it stretches for about 30 feet long, and it goes from the esophagus, it comes down to the stomach, then the small intestine, winds around a little, and then the large intestine and the colon. So if you think of a tube from one end to the other, whatever's in that tube is not truly inside of our body until we digest it and absorb it. So it's in the tube until we digest and absorb. So that's why it's that statement that basically you are what you eat. It's not truly you are what you eat, it's you are what you digest and absorb. We need good digestion and good absorption, and that all basically stems from having a healthy digestive tract. So does that make sense? Okay. So the other thing I want to point out too is if you think of the tube and you think of the lining of the tube, in our GI tract, the lining is only one cell thick. So we really, there's only a thin layer that's separating our external environment from our internal environment. So all the food that we're eating, the toxins and things that we're exposed to, our digestive tract is playing a huge role in trying to figure out what's good for us and what's bad for us, and what can enter into our body and what needs to stay out. So it's really important for the digestive tract to stay healthy. Alrighty, and you can see in the picture too, there's some accessory organs too. Those aren't connected directly to the tube or the tract. Things like the liver, the pancreas, the gallbladder, they're actually not they're not labeled in the picture, but they're in the picture, and those basically those organs act to support digestion and aid by releasing enzymes. So just wanted to point that out too. Alrighty. Number 3. So digestion starts in what part of your body?
Your mouth.
Exactly, yes. I thought I was going to trick.
Eyeballs.
Your eyeballs. Yeah, that's true. I start thinking about things. I thought I was going to trick you guys, but you got it. So in the mouth, yes. So that's why something as simple as chewing your food really well is important for digestion. So because chewing physically acts to break down food molecules and start the digestion process. So often nowadays we're leading really busy lives, and we're eating in a rush. We're eating in a stressed out state. So we need to slow it down when we're eating. We need to eat more mindfully and chew really well. Like your mom said when you were younger, chew your food really well. So mom is right. And the stressed out part too, like eating in a stressed out state actually stops digestion. So the hormones that we release, cortisol and adrenaline, these things actually shut down digestion. So we want to make sure that we're in a relaxed state when we're eating. We don't want to be on the go and rushing to eat. The other thing too that starts in the mouth is we talked about mechanical digestion, the physical act of chewing, but there's also chemical digestion that starts in the mouth too. So salivary amylase is an enzyme. Amylase is an enzyme that's released by your salivary glands, and that starts the breakdown process of carbohydrates. So we do have a little bit of mechanical digestion there too. And then digestion starts to, it starts to break down. So we talked about that already, but digestion continues in the stomach. So that what we're going to be talking about next. But basically, there's different enzymes in our stomach and acid that also starts to help break down different things in our food. So the stomach also provides mechanical digestion by churning and physically breaking food down. But there's an important acid. So that brings us to the next question, number 4. What is the name of the acid in your stomach that breaks down protein?
Protease?
That's an enzyme.
Oh, it's an enzyme.
Yeah,
that's one thing I take.
Yeah, exactly. So that's one of them.
What's hydrochloric?
Yes, exactly. Hydrochloric acid. So hydrochloric acid is the acid in our stomach that makes the gastric contents of the stomach acidic. So basically we want an acidic environment because that's when protein digestion starts to occur. So in an acidic environment, the chemical structure of proteins are physically denatured and broken down. So that's in the stomach is going to start our protein digestion. And hydrochloric acid is also responsible for activating pepsinogen, which is an enzyme that turns into pepsin, and that helps break down proteins as well. So here at TLC, we do recommend digestive enzymes for a lot of our patients because, for example, A blood types generally have less stomach acid, and that makes it harder for them to break down proteins. And if we're not breaking down our proteins properly, then we're going to have these undigested food molecules that are interacting with the rest of our digestive tract and trying to get absorbed. And these can actually cause inflammation. So for A blood types that generally have less stomach acid, we need to aid them and support them in digestion by utilizing digestive enzymes. We also recommend digestive enzymes for patients past a certain age, around 45, 50, because we naturally decrease the production of enzymes as we age. So it helps support digestion at that point as well. And then if there's anyone, of course, having any indigestion issues or bloating or gas and things like that, we help out with that as well by using digestive enzymes. And so the enzymes, the actual supplement has hydrochloric acid in it, so it supplements that, and it also has different things to break down fats and proteins, like you're saying, different proteases. Mm-hmm. Yeah. And let's see here. So any questions so far, or not really?
So far, so good.
I would ask a question.
Okay, sure.
When you were saying about blood type A in particular needs certain health assistance, what about O?
O blood types actually, so when we follow the general guidelines of the blood type, following the blood type diet, the O blood types are generally okay with digestion. They do well with eating proteins like meats and things. Oh. And they should stay away from gluten, grains, and dairy. That's going to be a little bit more upsetting for them, for O blood types. Oh. Yeah, but if you know, this is a generalized approach, so it's, you know, if you fall out of that, it's not, you know, it's not set in stone. So there might be O blood types that have difficulty with digestion too. So you might need digestive enzymes. Alrighty. And so number 5, where does the absorption of nutrients mainly occur in the GI tract? What part of the gut?
I'm the only one. Well, I would think large intestine.
Okay. Large intestine helps with absorption of water, but the small intestine is the answer. Mm-hmm. So small intestine. So if you look at the picture on the next page that I provided, you'll see that you'll see these little finger-like projections on the intestinal mucosal cells. So we're looking at the bottom picture. And you'll see that, so those are the cells of the gut lining. And you'll see these little projections. So those are called microvilli or villi. And they're located in the small intestine and it helps with absorption in that area. So it actually increases surface area so we can allow for better absorption of nutrients. So that's going to mainly occur in the small intestine, the nutrient absorption. And it also improves digestion because there's digestive enzymes that are embedded in those little microvilli as well. So it helps with digestion and absorption. And we'll talk about this picture a little bit more later. But number 6, true or false? The gut microbiome consists of the trillions of microorganisms that inhabit or live in your gut and outnumber human cells by a factor of 10 to 1. True or false?
True.
True. Wow.
Yes, true. So that means that there's more microorganisms in your gut than human cells collectively. So it's really important to keep these microorganisms balanced and healthy because they're controlling a lot of things. So things like nutrient absorption, digestion, bowel motility, blood sugar regulation, immune system regulation, and even things like your mood. So they also even produce vitamins too, like vitamin K and B vitamins. So it's really important to keep these little bugs healthy and happy. So there's some good ones, there's some bad ones, there's some neutral ones. And so we need to keep a balance. We need to keep the good ones outweighing the bad ones. And basically, different diets, medications, and things, inflammation can affect the levels of these. So, for example, eating a high sugar diet, refined foods, is going to cause things like yeast or candida to overgrow and cause good bacteria like lactobacillus species to undergrow. And so that can wreak a lot of havoc in our gut. And also eating good fibers are also going to keep our microbiome balanced. So that's why a lot of our diet is actually feeding these organisms and that live in our gut and are controlling a lot of different things in our body. And that's also why we utilize different testing like our stool test, and we often supplement probiotics, and even just eating probiotic-rich foods is going to help too, to keep things balanced. So let's see here. And when there are imbalances, I talked about this a little bit, it can lead to inflammation. So if there's imbalances in the microbiome, it can lead to inflammation, poor nutrient absorption, irregular bowel movements, and food sensitivities, and even things like leaky gut. So it is important to keep those things balanced. And just a little thing that we do at Tustin Longevity Center too is when we do a full history, we often ask our patients if you're vaginally born. And the reason why we ask this is because it helps us get an idea of how your microbiome started. The vaginal canal is filled with a lot of good, healthy bacteria. So when an infant is vaginally born, they're introduced to these good bacteria, and they allow the microbiome to really flourish at a young infant age. So it is important. And of course, there's emergent situations and things where a C-section is warranted, but we want to try to have vaginal delivery. Number 7, true or false? If I do not have gut-related symptoms, such as bloating, gas, abdominal pain, constipation, diarrhea, then my gut is healthy.
That's false.
Exactly.
It's a trick question.
False.
You're trying to trick question.
Right. So I was mentioning earlier about myself too. I never had any like gastrointestinal symptoms, but I was finding that a lot of things that I was concerned with were stemming from the gut. So I wanted to add that in because sometimes people associate having a healthy gut with, I don't have any symptoms of GI symptoms, so my gut must be healthy, but that's not necessarily true. So there's a lot of connections between the gut and other parts of our body, and that has to do with, like we talked about, the microbiome controlling a lot of things, and then also our immune system. We're going to get into that too, but the immune system that lines our gut is controlling a lot of things as well, and it's interrelated with a lot of different organs and systems in our body. Things like the brain, the gut and the brain have a relationship that can cause like mood disorders like anxiety or depression, even things like brain fog. And so there's also connections with skin, our immune system, blood sugar metabolism, And
Learning disabilities too.
right, exactly, learning disabilities as well. Yeah, there's a lot of connections there. And especially, so getting a little bit into the immune system, especially when there's a something called intestinal permeability, where our gut is not strong and healthy, that's when a lot of these things can arise. So there's, you know, when there's intestinal permeability, increased intestinal permeability, then it can cause things, different organs to be affected. So like the thyroid, the brain, and a lot of these things that we were talking about, the adrenal glands, like with stress, and the skin, and all these things. So that's why it leads me to number 8, the question basically. But the reason is because our digestive tract is a vital immune barrier, and that protects us from disease and contamination. Our gut lining accounts for approximately blank % of our immune system.
I've heard as high as 80 to 90%. I don't know if it's true.
Yeah, so roughly like 70 to 80% of our immune system. So I was kind of trying to get into this without really getting to the next question, but 70 to 80% of our immune system is found in the lining of our gut. There's something called gut-associated lymphoid tissue, GALT, and that is responsible for evaluating what comes into the digestive tract and figuring out what's good for us and what's bad for us. So it's basically getting inflamed based off of the foods that you're eating, if there's high inflammatory foods, and it's not getting inflamed if you're eating anti-inflammatory foods. So it's analyzing every little thing, and you know, that's why it's really important to eat a healthy diet, an anti-inflammatory diet, void of refined sugars and large amounts of carbohydrates and sugar, and making sure that we're, you know, focusing it on a anti-inflammatory diet. So let's see here. This lining is very tightly regulated. So things that get absorbed and left out are being really regulated by this lining that we talked about. So when I was talking about the tube and the lining, it's only 1 cell thick. That's what is determining what's inside, what comes in, and what stays out. And if that is damaged, then it allows a lot of bad things to come into our body. A lot of toxins, viruses, bacteria, and that can really overload our immune system and cause a lot of inflammation and kind of wreak havoc on other organ systems. What was that question, Tom?
Sure, I've got a question for you. So if it's true that up to 80% of our immune system lines our gut, I think of the immune system, you know, like I don't want to get a cold, it's flu season, I'm traveling, or I'm starting to feel sick. So what practically should I do to help my immune system that's related to the gut if so much of my immune system is surrounding the gut? Does that make sense?
Can you say that again?
Yeah, so if so much of our immune system is around the gut, I think of the immune system as fighting disease or bacteria, keeping me healthy, right? So if I'm starting to feel sick, how does that influence my immune system by what I eat or what I don't eat?
Oh, I see what you're saying. So when you're starting to feel sick, it's what should we do differently?
Yeah, if anything, can we do differently to help our immune system? Because I don't think of what I eat as affecting my immune system necessarily.
Okay, well, when you're starting with a cold or something like that, and your immune system is being activated, it's basically being activated by anything that you eat. So when, in particular, if you're coming down with something, then you do want to practice like fasting, basically, because you want to give your body a break from whenever you eat, the immune system is being activated. So you want to give that a rest and allow your immune system to work on fighting the infection. But we also like the concept of intermittent fasting, where we tell our patients to do this as well, because it gives our gut a break. And it gives our gut a rest from utilizing the immune system and activating it. So if there's things like autoimmune conditions, and if someone's suffering from an autoimmune condition, we do recommend fasting as a part of their daily routine, or daily intermittent fasting, or maybe like once or twice a week, a 24-hour fast, because this gives our gut a rest, and it gives our immune system a rest from activating. And a lot of autoimmune conditions are an overactivation of the immune system and that gut lining, the immune system in the gut lining. So by avoiding, by fasting and avoiding food, our body is not being activated. I think that answers.
I think you
the
answered it,
question.
yeah.
That's a little.
Maybe another way to ask it would be, what are some things that would be bad for our immune system if I'm starting to feel sick, or if I have some kind of immunodeficiency?
Right. So I guess that would go back to the diet and avoiding sugars and anything that's going to cause inflammation in the gut. So I guess we want to avoid antibiotics if we can, and other medications that might irritate the gut lining. And that kind of goes into some of these other questions that I have here too. So we can get into that. But I did want to say that a good way to figure out what foods are personally inflaming you is by utilizing our food sensitivity testing. And so that can really, with that, basically the results from that are foods that are causing inflammation in the gut lining. So your immune system is creating antibodies against certain foods. And those are the foods that show up on that test result, if any of you guys have gotten that done in the past. And by avoiding these foods, it'll allow our gut to heal. And a lot of the foods that come up on there might be foods that you are eating often, or those that are highly inflammatory. So things like yeast, brewers and bakers yeast, wheat, soy, dairy like cow's milk, and even eggs show up on there. So it's good. It's a good thing to get tested because it allows you to figure out what is inflaming you personally. It's not the same for everybody. And by avoiding those food sensitivities, you'll allow your gut to heal. And you also want to rotate your foods as well. So by rotating your foods, your body there's less of a chance of it developing an intolerance or antibodies against that food. Yeah. Okay. Yes. Question.
How are food sensitivities different than, say, a food allergy?
So a food allergy is going to be something that's more acute. So there's different antibodies that are produced against different things. So the IgM antibodies are the ones that cause acute allergies. The chronic ones are the IgG antibodies. And so with acute allergies, you might feel something from that when you ingest that food. So you might feel maybe like a little tickle in your throat or a little congestion, or you might feel like that anaphylaxis if there's a really severe allergy. But with chronic food sensitivities, you might not really feel any different. Sometimes people do get some situations where they realize they eat something and it might cause a little bit, maybe a little rash or congestion or something like that. But sometimes you won't feel any different by avoiding those foods. But we know that it's starting to heal the gut by avoiding those things. Yeah. That's a good question. Yes.
Sometimes I eat something and I don't know if it's a sensitivity or an allergy, but my nose will drip. Like peanuts, definitely peanuts.
Peanuts. Yeah, that could, it could be either or. You're probably sensitive. I mean, if you feel something, I would say the best thing would be to avoid that food. Mm-hmm. Yeah. Especially if it happens every time. And you can always get it tested. So we do test for the acute allergies and the chronic allergies. Mm-hmm. Yeah. Alrighty. So I guess we can go to number 9. If there's any other questions? No? Okay, so blank is a term being given to the changes that occur in the gut when there is increased intestinal permeability?
Leaky gut.
Yes, that's the right answer. Leaky gut.
Leaky gut.
So I wanted to point out this picture again on the next page, the bottom picture. So you'll see that there's these things called tight junctions in between the intestinal mucosal cells in the diagram. It's labeled there. And so these tight junctions are responsible for keeping those cells nice and stuck together. And in the past, it was thought that these tight junctions were cemented together. And so in the past, we thought that these tight junctions were cemented together and that nothing could really disrupt them. But now with research, we're finding that there's a lot of things that could possibly disrupt these tight junctions. And one of the biggest things is a molecule called zonulin. And zonulin is released from the small intestine, and it regulates this permeability of the cells. So it kind of opens and closes tight junctions. And zonulin is increased, like the release of it is increased a lot of times with the ingestion of gluten. So the gliadin protein from gluten will, the gliadin protein, otherwise known as gluten, from wheat, is a big trigger for the release of zonulin. And that can really cause a lot of disruption in the gut and lead to some of the opening of those tight junctions and allowing things like nutrients and toxins and bacteria and viruses to flow in between the cells rather than through the cells. Because ideally we want things to be absorbed through the cell, and not leaking in between. And another thing is that can be leaked through are food particles, so things that are not digested well, and that's how we can see those sensitivities come up as well on that food sensitivity test. So if there's a lot of foods on that food sensitivity test, it gives us an idea of how healthy that gut is or unhealthy, because if there's a lot of foods, that's telling me that our immune system is reacting to those foods when it shouldn't be, really. Could be a simple food, like a healthy food, like an apple, or what's something that commonly comes up on there, like a tomato or something, where you generally it wouldn't truly be inflammatory for you. And if we worked on healing your gut and you got that tested again, that sensitivity is going to go away. So if those foods are crossing through the barrier, our immune system is attacking that food, and then it's creating that food sensitivity. Yeah. So a lot of times I'll tell my patients to avoid gluten, because most of us, even if it's not like full-blown celiac disease, the way that our gluten is produced here, it's very genetically modified, it's hybridized, and it's almost in all processed foods, gluten and wheat. So I tell my patients to avoid that if we want to start healing the gut. So like I was saying before too, when there's this breach in the barrier, that can cause a lot of issues, because now it leads to open gates that allow a lot of different things to pass through, and our immune system starts reacting. And that's where this can really cause a lot of inflammation. Basically, our immune system is overreacting to these things, and it can affect virtually any organ in our body. And let's see, so the tight junctions, they can also lose integrity as a result of a lot of different things, and cause inflamed mucosal cells, and that's what we'll kind of talk about next. So what are some factors that will increase the risk of leaky gut? And those are found on that picture too. It's a little cheat sheet. So where it has that arrow there. So we talked about this a little bit, but a poor diet, so high sugar, processed foods, refined foods, we definitely want to cut those things out. Anything that's packaged or processed, we don't want to be eating. There's a lot of gluten in there. that can trigger that zonulin and cause increased permeability. Excess alcohol or excess caffeine, we want to avoid, and you want to avoid those food sensitivities that are there personally to you, and also some other things that can cause risk of leaky gut medication. So antibiotics, ibuprofen, steroids, they are also going to deteriorate the gut lining, and antibiotics a little differently because they'll imbalance that microbiome that we were talking about, the organisms that are in your gut, and then that imbalance can lead to inflammation. Stress is a big one. Stress can deteriorate the gut lining, and low stomach acid. So that's why it's important to have good levels of stomach acid and to help properly digest our food. Toxins and infections, and the imbalanced microbiome that's known as dysbiosis. So all of those factors can lead to an increase in leaky gut. Any questions?
We had a couple of questions from the online audience, and some of the doctors are answering, but just so everybody hears, I'll kind of shout them out. We had a question from Miss Veronica about probiotics. Can you share a little bit more about why you recommend alternating brands?
Yeah.
Dr. Mitchell spoke up on that one a little bit, and then Dr. Althorpe, but go ahead and give us your take on that.
Oh, okay. Yeah, I mean, I recommend, sometimes I'll recommend to my patients to switch up the probiotics because of the different strains that are found in all the different brands. And so we have two that we like to utilize here, and they're each a little bit different. And one of the probiotics that I like to use too are soil-based organism probiotics. So we have that in one of our brands, and then there's a balance of other strains in the other one. So you can switch between the two. Yeah. And also, when we look at the stool analysis test, that can give us an idea of your microbiome. So it'll let us know which good bacteria are growing or undergrowing, and then if there's any bad bacteria or dysbiosis in your gut health, in your gut tract. So by looking at that, we're better able to, pick a probiotic that's going to work best for you.
Got it. Thank you.
Yeah. Okay, so number 11. What can I do to start healing the gut lining? So we've kind of touched upon this a little bit, but what can I do? Any ideas? Yeah, that's true. Probiotics. Yeah. So we kind of have a process that we kind of try to follow, but we kind of tell our patients all at once that we want to remove the triggers and toxins. So that's number one. We want to remove bad things. So we want to remove anything that's going to cause inflammation. And a lot of those things that I've talked about in the last question. So processed foods, inflammatory foods, refined sugars, alcohol, gluten, food sensitivities. We want to remove all those kinds of things that are going to possibly cause inflammation. And so the other part, I was talking about the stool analysis test, but the stool analysis test also can show us if there's any parasites or any dysbiosis, and we want to remove and start fixing that too. So either by utilizing probiotics, or we have other like botanical antibiotic type herbs that we can use if there's like a parasite or any bad bacteria that's found in your stool sample. So we want to remove those things because those bad bacteria can cause inflammation and not allow the gut to heal. And then we want to start, well, the other thing I should mention too is stress. So we want to manage stress better too, because we want to remove stress the best we can. I know it's kind of easier said than done, but we want to try to manage our stress better too, because that can wreak a lot of havoc. And then we want to start replenishing our body with healthy nutrients and digestive enzymes if we need them to help with digestion, and probiotics to help with the microbiome. And so you can do that by utilizing probiotic-rich foods in your diet too, or by supplementing if it's needed. So there's different ways about that, but we want to start flooding our body with the nutrition it needs by utilizing or by eating, organic, healthy, organic grass-fed meats and proteins, green leafy vegetables, and healthy fats, things like coconut oil, ghee, butter, avocado oil, olive oil, eating avocados, things that are all going to be really anti-inflammatory, a lot of fish to help with our omega-3s. So we want to be doing that. And there's other things that are really gut healing. So specifically, things like bone broth are high in glutamine and collagen. So you want to be eating a lot of collagen-rich foods because the lining of our gut is made up of collagen and it needs glutamine too. So glutamine is an important amino acid that helps with the integrity of the intestinal mucosal lining. So in that picture there, those intestinal mucosal cells, they need those things to function better and be healthier and start getting repaired. And also things like coconut oil is really healing for the gut. It has antimicrobial properties. And things like certain herbs, like herbs and spices like ginger, cinnamon, those things are really gut healing as well. And also, I like to mention to my patients eating cooked vegetables, like steamed or sauteed, or steamed or sauteed or baked or whatever. Cooked vegetables are better than eating raw vegetables because they're easier for your gut to digest. Mm-hmm. But at the same time, if you're gonna I'd rather you eat raw vegetables than something unhealthy. So you gotta kind of pick and choose. But steamed and cooked are gonna be better for digestion. And you wanna have a lot of fiber, so a lot of vegetables, because that's gonna help, the gut motility. It's gonna help feed those healthy bacteria and allow for healing. Yes.
You talked about probiotics, and we've had some questions in the audience about probiotics. What about prebiotics? What are they, and should we be taking them?
Prebiotics are basically what feeds our healthy bacteria. So probiotics are the actual bacteria, the strains of bacteria. Those are called probiotics. And then prebiotics are actually the things that feed probiotics. Mm-hmm. So it's actually feeding the bacteria. And for prebiotics, usually, we're going to get a lot of prebiotic-rich foods just by eating a healthy diet and a lot of vegetables, because those fibers are actually acting as a prebiotic and helping to feed those those healthy bacteria in the gut microbiome.
Great.
Yeah. Good question. Okay, so let's see. And then the next thing that we want to do to repair the gut lining is introduce supplements. So that brings us to the next question. So what supplements are helpful for healing the gut? Oh, actually, I wanted to say one more thing about the gut lining. We talked about this a little bit, but the intermittent fasting or the time-restricted eating is also a really beneficial way to start healing the gut, start to heal the gut lining. Because like I was saying, it gives your gut a rest, and it gives your immune system a rest from analyzing and digesting your food. So time-restricted eating or intermittent fasting, that's basically a daily fast where you only eat for about 8 hours out of the day, and then you're fasting for the rest of the time. So about 16 hours of fasting, and that's basically ideally only drinking water, and that's going to give your gut a nice rest. And this way, your cells also go through cell destruction. That's called autophagy when you're in a fasting state. So you're able to recycle damaged cells and inflamed cells when you're in a fasting state. So that's also a beneficial way to help start the healing process. Another benefit of fasting is basically just restricting calories. We're leading pretty sedentary lifestyles. You know, at my office job, I'm just sitting all day, and so I'm not doing manual labor. I don't need a lot of extra calories. So by fasting, you kind of limit your calorie intake as well. So it's helpful in that way too. Question.
We've had some questions and comments about what types of foods are gut friendly. Some of the doctors spoke up and mentioned things like kombucha, kimchi, sauerkraut, fermented foods. And then we had some questions still unanswered about how often should we eat these types of foods? And also, does steaming foods lose a lot of the nutrition content?
I would say, so how often to eat those foods? I would say a daily, daily intake would be good. So those are good foods, like what was mentioned, like fermented foods would be like sauerkraut and kimchi, kombucha. They allow us to replenish our microbiome by introducing healthy bacteria through those foods. I would say as often as every day, in little amounts as, I wouldn't say there's an exact
number
dose of what you should take, but you don't want to overdo it either, but kind of just listen to your body. And I think that would suffice. The whole cup?
Yeah.
I would say, or kombucha or sour. No, I think the kombucha is fine. A cup of kombucha, yeah. And usually in those big bottles, there's 2 servings. So just the 1 serving, and you just want to watch the sugar in the kombuchas too.
Some can have a lot. Some don't.
Some of them can have a lot. So you want to look at the back of the label and make sure there's not a ton of sugar. And the other question is
steaming and cooking food.
Steaming. I would say that there's different vegetables benefit from being steamed and versus eating raw. So you can get different nutrients from steaming your vegetables and eating them raw. There's different nutrient concentration in both ways. Both are beneficial. So steaming is not necessarily going to get rid of all of this healthy nutrients that are in your vegetables. They might be a little different. So you're still going to get a lot of nutrition. It's just going to be a little bit different, and it's going to be easier to digest if they're steamed. So if you're really working on healing the gut and there's a lot of issues that are stemming from there, I would say eating steamed would be better. But like I was saying before, raw is better than eating something unhealthy.
Sure.
Okay, so we talked about that a little bit, and then, so number 12, this is my last question. What supplements are helpful for healing the gut? We kind of talked about this throughout the whole seminar, but any ideas?
Probiotics, right?
Probiotics, yes, that's a good one. Yes.
Glutamine?
Glutamine.
There's a question about foods that have glutamine.
Digestive enzymes.
Yeah.
So glutamine, digestive enzymes, probiotics. So glutamine, I think there's a little bit of talk, where can we naturally find these in foods? So glutamine is naturally found in protein-rich foods. So like your meats, beef, chicken, fish, and also certain vegetables too. So, and bone broth is a big thing that we could be doing too. That has very glutamine rich. And then other things will be, we want to correct nutrient deficiencies. So we do utilize another specialized test here, our SpectraCell test, that allows us to see if there's any nutrient deficiencies. It goes into 30 different micronutrients around there. And it looks at like B vitamins, antioxidants, different minerals and things, your proteins. and we're able to see what nutrients you might be deficient in. And so it's a very thorough panel. And by doing this, we're able to supplement or make dietary recommendations to help you guys utilize or intake more of those nutrients and provide our body with what it needs. So we want to correct those. Big ones are vitamin D, B vitamins, zinc. Those are really important ones because zinc can help with that tight junction function. So the structure and the function of the tight junction, zinc's really important for that. And let's see what else. So I wanted to point out this too. So fatty acids are going to be really important. The omegas that we recommend here are alpha-linoleic and linoleic acid. So these are the two essential fatty acids that our body can't produce, and it needs to be found from a dietary source. So we recommend supplementing with these, the alpha-linoleic and linoleic acid, instead of things like fish oil. So fish oil is like EPA, DHA, and those omegas can actually be made from the alpha-linoleic and linoleic acid. So if we supplement from the very top of the chain, anything can really be made from there. And phospholipids are really important too. So if we look at these two pictures, this is a picture of the cell membrane. And so each cell membrane, every single cell membrane in your body, so the cells that I talked about that are lining the gut, those intestinal mucosal cells, those all have a cell membrane on it. And this is the structure of the cell membrane. And so there's proteins and fats and cholesterols in this structure. So that's why we recommend eating those things. But also the omegas that I just talked about, the linoleic and alpha-linoleic acid, those are really important for the structure of the cell membrane too. So whenever we have a damaged or inflamed cell membrane, which is seen on this picture, there's oxidative damage and stress on the cell membrane, and it's damaged, then we need those things to help repair it. So phospholipids, cholesterol, proteins, that's what we need. And so with the cell membrane being made up of phospholipids, we do also recommend supplementing with a phospholipid supplement. We have NT factor powder here. And also our doctor's nutrition bar is packed with phospholipids too. So that can be utilized as well. And that basically helps to repair that cell membrane. So if there's inflammation in the gut or anywhere else in the body, we need those things to help repair the cell membrane. Yeah, so I guess that kind of wraps it up. But basically, we want to give our body what it needs, the nutrition that it needs. We want to do our best to help with digestion and absorption by taking care of our gut. And so that way we can kind of replenish our body with the nutrients that it needs. And our body is really apt to heal. So we just have to give it what it needs and remove what doesn't serve it, and it will heal. And we talked about digestion and diet a lot today, but there's a lot of other factors that play a role in optimizing our health. So there's a lot of pillars of health. Diet is a big one, exercise, stress management, sleep, good water intake, and all of these things are going to help optimize our health. So it's, they all play a big role. They're all pillars in our health. And so we talk about all these things here. When you come see one of us clinicians, we'll talk about these things and try to figure out lifestyle changes, use supplements to help kind of, restore a healthy function altogether. Yeah. And so, are there any other questions? That kind of just wraps up all the questions that I have that I put together. Or if there's any ideas for topics for next time, next month, or if anything didn't make sense, I can go over it again.
I think we did a great job. We had several of our other physicians online answering a ton of questions that were coming in. I brought up a couple of them.
Good.
And you've got a big fan club. A lot of people just saying they appreciate what you're saying and lots of good information. So thank you.
Oh, good. I'm excited.
Very good.
Thank you.
Thank you.
Thanks for your time.
Thank you.
All right, folks. If there's no other questions, we'll wrap up for tonight. Thank you all so much for joining us.
Yay. Thank you. Thank you. Thank you. So good.
Thank you.
That was good.
Yeah, we're good.
Okay.